Hi, I'm Gary Bebow, CEO of WRHS Health System, and this is my September CEO Connection. Today, I'm really pleased to have Michelle Hagen, an APRN, with us that's involved in and leading our weight loss clinic over at White River Medical Center Surgery Clinic. And so, you know, today we all know of the problems we have in our country and in terms of people being overweight and obese, and it's really a national problem in terms of the other illnesses that go along with or associated with being too heavy. And so, Michelle, I want you to talk a little bit about this clinic we got and how long we've been doing it, and what differentiates us perhaps from some of the other alternatives in weight loss, and maybe you can talk a little bit about some of our success stories that we've had. So why don't you just talk to me a little bit about it?
All right. Well, basically we seen that there was an issue with a lot of our surgery patients being obese prior to going to OR, and we felt like maybe we needed to do something to try to help them lose the weight because it decreases complications for the operating room. And so Jessica and I kind of got together and we decided that maybe we should try to do a weight loss clinic where we can have patients from the hospital or other like ortho patients or whatever come to us to lose some weight prior to going to the OR. And then we just decided, well, why don't we just open it up to the public and put it out there. The nearest weight loss clinic is Jonesboro, and that's an hour away. And so we thought, well, if we just did it here, it would be beneficial to everyone. And so we set it up and we got it going. Our first clinic was actually on June 4th. We were having clinic from 5 to 7 in the afternoon on Monday afternoons, and it was a huge success. I mean, we were booking 3 weeks out when we first started. Yeah, wow. It was awesome. So from June, we had 41 enrolled when we started. We currently only have 15. We've moved the days from Monday afternoons to Thursday afternoons. We've seen that we're having some issues with, patient scheduling with kids and stuff like that in the afternoon, so we moved that. The reason I think that we stand out from other weight loss programs, is that, number one, it is a practitioner-driven program. When you make an appointment, you come in and you're one-on-one with someone. We sit down and we talk with you about what we offer. We offer diet plans. We offer to help you set up diet plans, help you figure out how to count calories, how to read labels, all that type of stuff. And we also teach exercise and portion control. So with that, and on top of that, we offer medicines, to help with that. And I think that's what makes us different from a lot of the other weight loss programs, in the area. I feel like that we can help the community. We have quite a few patients who are morbidly obese who come and see us. One patient that we have come, she weighed over 300 pounds when she came. We sat down, we talked about what her goals were. Set reasonable goals, because a lot of people, when they set a goal and then they don't meet it, they just want to give up and say, forget it, I'm not going to do it. So you set reasonable goals, reachable goals. And so we talked about diet, we talked about exercise, and she's lost over 20 pounds in the couple months she's been coming, and she's lost 19 inches, which is significant for somebody who's obese. And a lot of times when they come, they just want to be held accountable. They just want somebody to point their finger at them and tell them that you don't need to eat that. But I give my cell phone number out to all the patients, and they can call me anytime. And I've had a few call me to ask questions about this or that. But so far it's going very well. And we have a lot of very appreciative patients.
Tell me, is the access to the program, is this through self-referral, or do you need to have another physician make the referral, or just
no?
What's the deal?
It's we have a phone number. We have a dedicated line at the clinic, and they call that and set up an appointment. You don't have to have a referral to come and see us at all. some physicians in the area are actually referring patients over to us, and they were actually referring to Jonesboro, and so now they've started referring over to us, and so we see quite a few patients for that.
It's more convenient for patients in this area to be able to access it locally.
Yeah, yeah. We had another young man who came in to have a hernia repair, and he came to visit with us and came to see us, and he had a month until his hernia repair, and he lost 15 pounds in that month with doing the program.
Helps his outcome too, doesn't it?
Yes.
Much safer.
Yes,
so.
It's much safer for the surgery, better outcome for the hernia repair. So.
Well, it sounds like we're off to a great start, and
it is.
Things will really even get better from it going forward as more and more people have success stories like you described.
Yeah, yeah. I tell you, some of the people who come in and actually lose weight. I mean, it's just sometimes the appreciation that they have, and I've done it, so it makes them feel really well, and to have somebody pat them on the back for doing it, I think that makes a lot of difference for them too.
I can tell it's a real passion of yours, and I appreciate your effort and interest in taking on this initiative. So thanks for coming today. And glad to talk to you. Thank you.
All right,
we have 2 employees of the month to recognize, and what's really impressive about these 2 is that they've been within the system for many, many years. And so first at Stone County Medical Center, Cheryl Waters, an RN at Cardiac Rehab, has been recognized for their Employee of the Month. She's been with us for 17 years, and she's known for having a really good, strong work ethic. And so congratulations to Cheryl. At White River Medical Center, Melinda Parker, a clinical educator from the Clinical Education Department, has been selected for demeanor. Now, Melinda has been at the hospital for 22 years, and so along with Cheryl, these folks have really contributed greatly to our success. And so if you see, when you see Cheryl and Melinda during this month of September, be sure to acknowledge their recognition. So congratulations. Regarding White River Health System, there's some things that I want to bring you up to date on. First of all, our Chief Financial Officer position was filled by a new CFO, Gene Winters. Now, Gene will be joining us on September 17th, and he comes with a great background in finance, a lot of experience, and most recently has been in the Boston market. And so during the interview process, all of us were really impressed with Gene and the things that he'll bring to us in terms of education of all of us and make us better financial stewards, and just I think just great expertise in hospital finance. So when you see Gene during this month, be sure to welcome him aboard. We got a couple of events in the community that will be coming up. First of all, in our prostate screening will be held on September 18th. As in the past, volunteers are needed. And in the Health First Women's Health Expo is October 23rd. We do that each year along with the cooperation with First Community Bank. In both of those cases, if you'd contact Bailey Williams, if you have the opportunity to or the time to be able to volunteer, I know we could really use your help. Regarding the Health First Women's Expo, there's booth space for departments within the hospital that would like to market their services, and so again, if you have an interest in that, be sure to contact Bailey as well. We now are in the robotic business regarding orthopedic care. The Mako surgical system has been acquired by the hospital, and we are now in the process of implementing that along with the orthopedists who have been trained and are excited about bringing this new technology into Batesville. A lot of marketing will be taking place that will describe the advantages of the Mako robotic system, but clearly this is a great step forward for us in technology in providing the very best care in orthopedics for the people that in this area. So I'm really looking forward to having that with us. The school systems are now in session, and along with that, there's common colds and flu that is oftentimes come as a result. I just want to remind everyone that we do have weekend hours in several of our clinics. We have it at our Children's Clinic, the Melbourne Medical Clinic, the Newport Clinic, and the WRHS Medical Complex at Southside. So walk-ins are welcomed, And so if there's a need arises during the weekends that want access, that's an alternative to the emergency room, please access them and let your friends and neighbors know as well. So that concludes my CEO Connection for September. I appreciate all the feedback that has allowed us to make this more informative and better for you. So if you have any more suggestions, be sure to let us know. So thanks and have a great month.